All right. I would like to now introduce Irene from the University of Chicago. She will be the first to share tonight during our presentation. If you could share a little bit with us about yourself and the study that the University of Chicago is holding, that would be great.
Yeah. Hi, everyone. My name is Irene Katsagalos, and I'm a research coordinator in Dr. Dana Suskin's lab at the University of Chicago. So the current study that we're doing is called Project Aspire. And the goal of this study is to address disparities that are experienced by children with hearing loss. So we use an early intervention curriculum that was designed in our lab that guides parents of children who are deaf or hard of hearing through education and skill building exercises that allows them to become effective collaborators in their child's language development. So we use a recording device called a Lena, which is about the size of a cell phone, and this Lena studies the sound environments of children with hearing loss. So how it works is participants do a total of 16 recordings, and each recording lasts for 10 hours. So these first 13 recordings happen once a week for 13 weeks, and the last recordings happen once a month for 3 months. So what you would be doing is the participant would be home and going about your daily life, and we have these specially designed T-shirts that have a little pocket in front that fits the recorder perfectly. So when we say that a recording needs to be 10 hours, it doesn't mean sitting at home for 10 hours, but just being around your child for 10 hours. So if that means going to the grocery store, going to a family member's house, that's completely fine. We just ask that it lasts for 10 hours, so it's turned on when your child wakes up in the morning and then is turned off at bedtime. And if there's a nap in there, that's completely fine. That nap can be part of those 10 hours. So the entire study lasts for approximately 6 months, which seems like a very long time for some people, but the last 3 months, it's just that one recording a month. So it's not doing a lot for those 3 months. And then in addition to the 16 recordings, participants also take place in some assessments and surveys in our office at the University of Chicago. So it does require participants to come to the University of Chicago for those 3 meetings. And I actually am the main person that runs those meetings. And it's mostly focused on the parent, and the parent fills out a number of surveys asking about their experiences with early intervention therapy, experiences parenting in general, parenting a child with hearing loss. And then there's one assessment that I do with the child, but it basically just seems like playing with toys, and it lets me know a bit about where he or she currently stands developmentally. So those 3 meetings range from 1.5 hours to 3 hours. And the other thing they involve is a half-an-hour videotape where I leave the room, so it's just the participant, the mom and child in the room, and there's a video camera that records them playing together and reading together for a half an hour. We are looking for children that are 4.5 or younger and that do have some sort of amplification. So either a BAHA, hearing aids, or a cochlear implant. It doesn't matter how recently the child received this amplification as long as they do have it. And we're open to recruiting as far away as somebody's willing, as long as they're able to travel to our office for those 3 meetings. So it would be 1 meeting, and then 3 months later the second one, and 3 months later the final meeting. And then as far as the recordings go, we either FedEx the recorders to you, or we have someone from our lab bring them back and forth. And then the curriculum component of it happens once a week for 10 weeks, right in the middle of the study. So we have one of our Aspire interventionists either travel to your home, or if you're close enough, you can also come to University of Chicago for that piece of it as well. And the curriculum component, people have found to be extremely helpful and very very eye-opening as far as different things you can do if you're parenting a child with hearing loss. As far as compensation goes, it ranges between $300 and $400, and that, it ranges between $350 and $400, and that $50 difference is a bonus for staying on schedule. So as long as you let us know ahead of time if you need to reschedule, and most participants, in my experience, receive the full bonus. So if you're interested in participating or know anyone that would be interested, you can give me a call at my direct line, which is 773-834-4443. I'm going to say it one more time just in case. 773-834-4443. And then my email is my first name, Ireni, E-R-E-N-I, at uchicago.edu. And if you are someone that knows of someone that would be interested in participating, and you can go ahead and ask them if they would feel comfortable having me reach out to them and email me their name and phone number, and I would be more than happy to contact them. Or if you want to call, if you're someone that's interested and wants to call yourself, you can call me at that direct line, and over the phone I can give you even more detailed information, and then we'll just do a 10-minute questionnaire to see if you qualify for the study. So yeah, I think that's about it. Thank you, Carrie.
Thank you. Next up to share will be Dr. Stiles at Rush, and if you would again share a little bit about yourself as well as your study.
Sure. Can everybody hear me? Can anybody hear me?
Yeah.
Yes? Okay, all right. I wasn't sure if my mute button was working. That's why I just wanted to make sure. So first of all, I just want to thank you for inviting me to participate in the talk tonight. And I hope that some of the listeners are inspired to participate in a research study just because research is so important in advancing our knowledge of ways that we can really help children with hearing loss, you know, have the same outcomes as children without hearing loss and, you know, maximize their potential. I used to be, and I still am part-time, but I started out as a clinical audiologist, and I worked in a children's hospital for quite some time before going back to get my doctoral degree, my PhD degree. And really that was because I found that there was a lot of work I was doing with children at the time that just seemed like there wasn't a lot of evidence maybe, or that we were kind of feeling our way around, especially because we were really seeing the population shift to a much younger age after newborn hearing screening really came into place and we were diagnosing children with hearing loss at such young ages. So I was really interested in kind of joining the research end of things and decided to go to school to get my research degree, and I did that at the University of Iowa, where I did a project looking at the effect of hearing loss on word learning and working memory in children. And after I completed that project, I moved to Chicago, and I am now working at Rush University as an assistant professor, and still continuing that line of research, looking at some of the factors that really influence how well children with hearing loss are able to learn new words, basically, in the face of some of the different ways that they perceive auditory input. So I currently have two projects that I'm working on right now. I have one project where I'm looking for younger children around 4 to 5 years of age. These children can be normal hearing, or they can have a hearing loss, fit with hearing aids or cochlear implants. This study is looking at how children sort of build a network of words and meaning around different concepts. So some of the tasks that children would do in this study would be to like name all the animals that they can think of, or name all the colors that they can think of, and kind of how many items are they able to generate within a certain category. That study it only requires one visit. It probably would not take more than a half an hour in most cases. That can be done either at Rush, or I can travel to the family's home if anybody's interested in participating within the northern Illinois area. The second study I'm doing is looking at some other factors that are involved in language development. This study is looking at how children use working memory and visual cues to support speech perception. So this study, I'm looking for children who are between 6 and 12 years of age. Again, either children with normal hearing who would serve in the control group, or children with hearing loss with cochlear implants or hearing aids. This study takes about 45 minutes to an hour. There's a working memory test that is performed, as well as a kind of a speech reading test. It's kind of a game the kids play where they kind of pretend that they're helping to fight Martians. So it's kind of a fun game to keep them engaged. And then, like the previous study, that can be done in a single visit, either at Rush University, or I can travel out with my equipment. So compensation is basically in the form of a prize for the kids who participate. For families who are traveling from outside of Cook County, I can also reimburse mileage if they're coming into Rush. Like I said, otherwise I can come out to them. So I can be reached either by email or by phone. My email is childhearinglab, all one word, @rush.edu. And my phone number is I forget if I'm going to give you my cell phone number. It's 312-942-9967. And that's what I'm working on.
Thank you so much. All right. Dr. Redleaf is next, and she is with the University of Illinois, which is also where our state EDDI program is housed. And our Illinois EDDI program has graciously provided this toll-free conference line tonight for us to use. So thank you for that, too. All right. Dr. Redleaf, are you ready?
I think I just unmuted myself.
Yes, you're good to go.
Okay, very good. Well, first of all, I'd like to say thank you, Carrie, for arranging all this. And I think you've done a fantastic job. And I always like with every synagogue service to hear the announcements. It's where you get to find out what's going on around the world. So I really appreciate your inviting us. First, I'd like to talk about myself. My name is Miriam Redleaf, and I am an otologist, neuro-otologist, meaning that after my residency in ear, nose, and throat, I did an extra year of ear and skull-based surgery training. And since that time, which was 1993, which is 20 years ago, I've been exclusively an ear and skull-based surgeon. So I do everything relating to the ear, from taking out wax to removing brain tumors. And I've had the privilege of developing two different operative approaches. One is a different type of mastoidectomy for the people in the Chicago area who are of descent from the original inhabitants of our country, because they have a different genetic profile and require a slightly different operation. And I also recently have also worked with endoscopic ear surgery and developed a approach to the internal auditory canal directly through the ear that doesn't require making a craniotomy. So these are the kind of things I've been able to do because of my specialized training. Now, at the University of Illinois, which is on Taylor Street, we have the University of Illinois, the actual university there. We have the medical center there. We have the Illinois Eye and Ear Illinois Eye and Ear Infirmary, which is the oldest ear, nose, and throat program in the country. And we also have the Children of Peace School right across the street there, a program that perhaps people have heard about, as well as the Lions Research there. And as you said, the DSCC is nominally situated at the University of Illinois. So what we have there at the University of Illinois is a large patient base. And what we've done at the University of Illinois is beginning to organize those patients into comprehensive databases. Since I'm an ear specialist, I do basically everything. So we've created a database of the people with ringing in their ears and how you treat those people and how you make them feel better. A database of people with balance disorders, how you evaluate and treat those people, how you make them feel better. A database of people that have bone-anchored hearing aids, as was mentioned earlier. And then the subject of this call, of course, the database of the cochlear implant patients. And what this database that we use now is called REDCap. And what it is you acquire all the data real time, but the way that it's organized in the computer interface is that you can analyze it and you can process it much more easily than you can with, say, the electronic medical record or an Excel spreadsheet, this kind of thing. And the difficulty with creating a base like this is that you have to go to each clinician and you have to pin them down. What do you really want to know about every single 2-year-old cochlear implant patient? What do you really want to know is if you're a psychologist? What does a speech-language pathologist want to know? What does the audiologist want to know when she tests the patient? What does she want to know when she programs a patient? What does the social worker want to know? So we had to go to each of the geneticists. What parts of the MRI report and the CT report do we want to extract? So this is really very laborious to pin everybody down exactly what they want to know and then to develop the format in which this information would be acquired in every patient. Before the onset of using the database, we were able to actually do one comprehensive study of cochlear implantation because I began to notice clinically that people after their implantations, especially adults, the hearing began to fall despite the implant. So we looked at this across all age groups, and this, of course, is before the time of the database. We had to laboriously go through patient charts bit by bit like this, and we found that over time, just as people with normal hearing, their hearing drops over time with aging, we see exactly the same pattern of hearing loss with people with cochlear implants. These are the kind of things we're able to do at our university because we have such a large patient base due to the length of time that we've been in business there. Now, one way in which we differ from other programs in the city is that we accept people in the condition that they come to us. When they come to us and they say, I want my child to be purely oral, we accommodate that. When they come to us and say we want our child to learn sign as well as oral, we accommodate that. So we differ from the rest of the city. And in fact, just recently, we've been digitizing our old videotapes. And we find videotapes from 20 years ago. And even back then, the speech-language pathologist is using a combination of oral and sign with the patient. Now, with respect to specific research studies that Carrie asked me about, the speech-language pathologist and the audiologist are very interested in the effect of reading to children, to hearing-impaired children. And they've arranged a study taking hearing-impaired Spanish-speaking and English-speaking children. These are English-speaking families, and these are non-signing families. and assessing the level of language skills or receptive expressive language in these children under 36 months of age, and teaching the parents how to read to their children. How do you position the child? How do you use intonation? How do you use your melody? How do you indicate on the page what's going on? Repetition, this kind of thing. Teaches to the child, teaches to the parents, encourage the parents to be creative, encourage the parents to read with the child, and then send them home with books, English books for the English speakers, Spanish books for the Spanish speakers. And we also have a research coordinator to call them and check and make sure that they're actually reading to these children every night. And then bring the kids back on a regular basis to check to see what their language development has come to. You compare these children that have gotten this intervention to children that have not gotten the intervention, just for a 6-week study, though, not for the, I think it was 9 months that the Irene was speaking about, a 6-week study, and follow up after that and find out what the difference between the two groups, the English-speaking intervention and control group and the Spanish-speaking intervention and control group. Now, we actually are working with our own patients on that, rather than bring patients in from other institutions. But if you'd like to find out more about the study or find out more about our program at all, you can call. Our program is called Happy Ears on Taylor. Our cochlear implant program is called Happy Ears on Taylor because Taylor Street is where the University of Illinois is. The number is 312-996-8930. And the email of the lady in charge of this particular study, her name is Jean Hayes, and her email is HAYES-SLP, Jean Hayes, SLP, @uic.edu. And that's, I think, about everything I need to say about this.
All right. Thank you so much.
Okay, I'm going to put you on mute now.
Okay, thank you. All right, and then we're going to wrap up with Dr. Bondurant at Illinois State University, and she's going to share about her study.
All right, can you hear me okay?
Yep.
Good. All right. Well, thank you very much for having me. I appreciate you inviting somebody from downstate. I'm representing downstate right now, I guess. So I'm excited to be here. My name is Lindsay Bondurant, and I'm an assistant professor of audiology at Illinois State University. I am also the director of the Children's Hearing Evaluation and Rehabilitation Program at Illinois State, which is a fairly new pediatric audiology and rehab clinic and intervention program that we've gotten off the ground in the past year and a half. So we're very excited to have some new things going on at ISU. My background is I started off as a pediatric audiologist. I practiced in Philadelphia, and so that is my first love is working with kids and families and identifying hearing loss and working with families as they go through everything that happens that goes along with that diagnosis. As I was working full-time in clinical pediatric audiology, I really started looking at how successful or what difficulties my patients were having as they started school, and I realized that we have quite a few gaps in our knowledge about what skills really make kids with hearing loss successful in school. You know, we know a lot about hearing and amplification, and we know many things about technology and language evaluations, and we've got great information coming in about early intervention. But I was still seeing that a lot of my families and a lot of the children I worked with were still having a hard time sometimes at really making things work as well as they wanted to. So I became very interested in that, and I decided to go ahead and leave Philadelphia and go get my PhD at the University of Texas at Dallas. And I ended up doing research in a developmental psychology lab, which ultimately was a perfect fit for me because I'm really just interested in how kids develop and how they can be successful. And so the area of interest that I developed was in self-regulation. And self-regulation is all about how kids learn to control their own behavior and follow directions and, wait and do the things they're told, and all of these things that are really important for doing well at school. And what I found in my research there is, in the work that I was doing, is that self-regulation skills, self-control and direction following and things really predict a lot about how well kids do with school. And it's an area that hasn't been well researched for kids with hearing loss. And so I'm very interested in looking at some of these skills other than just language and, cognitive knowledge and things like that. Look at actually how well kids have these other skills that can make them be successful, because I feel like if we look at that a little closer, determine maybe some of the things that we could be doing differently to give kids a better start when they get to school, that ultimately they're going to be more successful, and that's really what we all want. So, however, doing research in this area is pretty tricky. Self-regulation is a little bit hard to tap into, especially with younger children, and it hasn't been done with kids with hearing loss. So really what I want to do at this point is collect some what we call pilot data, some very basic information before we launch some larger studies. And so I want to collect some pilot data where I'm just, the first one I would like to let you guys know about would be a self-regulation study, just looking at development of self-regulation skills in children with hearing loss. And like I said, that hasn't been done before. And so I am fairly open in terms of ages and types of hearing loss. So as long as a kid is older than 2, we could enroll them into one of these studies all the way into elementary school. And I'm open to any degree of hearing loss, any amplification arrangements of hearing aids, cochlear implants, no amplification at all, bone conduction hearing aids, anything. And any communication mode, so listening and spoken language, sign, bilingual, bicultural, I am open to that because I'm really just interested in how kids with hearing loss develop these skills. And so when I do these evaluations, it would be a battery of evaluations, and it's actually pretty fun for the kiddos. We do some, it's a lot of playing, just like, a lot of the things that we do with kids. So an example of a self-regulation evaluation would be a delay of gratification task. And so we might tell a child, and usually kids who are, say, around 5, they get what they're supposed to do there. You might give them an Oreo cookie. You have 1 Oreo cookie on one side and 5 Oreo cookies on the other side, and you tell them, you can have this 1 cookie right now, or if you wait for a few minutes until I ring this bell, then you can have these 5 cookies if you can wait. And so then you leave the room and the child has to decide, do they want to wait? Do they have the self-control to wait those few minutes until the bell rings and they can have more cookies? Another example would be what's called a forbidden toy task. And so you get a really fun, like, toy car out, and you show it to the child and play with it a little bit, and then you say, okay, well, I have to leave the room for a minute and fill out some paperwork, but I'll be right back, and when I come back, we can play with this toy together, but I don't want you to touch it until I come back. And so then you leave and you see if the child is able to resist playing with that toy. Those are just some real basic examples of self-regulation evaluations we might do. So it's kind of fun. The kids are, playing and eating cookies and things like that. And we are observing that and seeing, how can they follow those kinds of directions? Can they resist the toys and things like that? And really, there's kind of no right or wrong answer. Most kids develop these skills at some point, so I'm really more interested in when do the kids with hearing loss develop those skills? Are they developing them on the same timeline as kids without hearing loss, or does it maybe take a little bit longer for them to develop those skills? So the only way I'm going to find that out is if I get some kids with hearing loss who are willing to come play with me or let me come play. So we can either do that at Illinois State University here in Normal, in my lab, or much like Dr. Stiles, I can be pretty portable and bring my cookies and cards to anybody who wants to enroll. So that's one thing we're doing. And then the other study that I'm interested in is along the same lines. This is a study I'm actually collecting some early pilot data, or hoping to collect some pilot data with Dr. Stiles, who spoke to you a few minutes ago. Dr. Stiles and I are interested in a fairly large project that is examining the relationships between early intervention and school readiness. And so we have some hypotheses about those relationships between how much early intervention kids are getting and how and whether or not they have all the skills they need to start school. So for that study, we would be looking to enroll kids anywhere from 2.5 to 6 years old. It would be fairly simple. We would ask some questions to try to understand your child and your family's experiences with early intervention, when they were enrolled, how often they got services, things like that, just kind of an interview or a questionnaire. And then we would just do a battery of language and school readiness evaluations on the child. So language tests, school readiness tests are, sort of these tests of how well do they know their letters and their numbers and things like that, and then some of those self-regulation evaluations I just mentioned. So sort of looking at school readiness in a broader context rather than just language, because if you think about what's going on in a kindergarten classroom, yes, language is important, but there's lots of other things that we're asking kids to do, follow directions and interact with each other and have a certain amount of knowledge before they ever walk in the door. So we're very interested in exploring that a little bit more because, again, we need to, if we're going to be successful as professionals at preparing kids for success in school and giving them what they need, we need to broaden our definition of what does success mean and what does readiness mean. So those are the things that we're interested in. So I am, at this point, I'm thrilled to get any kids I can who have hearing loss, any families who want to come talk to me. I am just doing some real basic evaluations, so I can be contacted at, I'll give you my phone number first. It's area code 309-438-5704. And my email address is lbondur@ilstu.edu. And I can be found on the Illinois State University website for the Department of Communication Sciences and Disorders, if that's an easier way to find me. So that's all I have. Thank you.
Thank you. Excellent. Before we go any further, I want to thank the 4 professionals that called in tonight to share about their research studies and the action that's happening in Illinois. Thank you, thank you, thank you. And now we do have some time left to ask them any questions that you may have. If you have a question for anyone in particular, if you could ask, make sure you ask that person, as well as, again, don't forget to just say who you are before you ask your question. So, anyone have any questions?
This is Kristen. It would be great if we could get the contact information one more time for all the participants.
That'd be great, great. So with that, Irene from University of Chicago, can you start first?
Yeah, first name is Irene, spelled E-R-E-N-I, and my phone number is 773-834-4443. And my email address is my first name, so E-R-E-N-I @uchicago.edu. Let me know if I need to repeat any of that.
You know what? Why don't you repeat at least the phone number one more time?
Okay. The phone number is 773-834-4443, and that's my direct line.
Thank you, thank you.
Thank you.
Dr. Stiles at Rush, would you mind sharing your contact information again?
Not at all. So just to remind people, I'm looking for children between 4 and 12 years of age, so a wide swath there. My phone number is 312-942-9967, and my email is childhearinglab@rush.edu.
Thank you. Dr. Redley, University of Illinois, Chicago?
Yes, can you hear me?
Yep.
Okay, our telephone number for the Happy Ears on Taylor program is 312-996-8930, and the email for this particular study of reading to your children who are less than 36 months of age is Hayes, Hayes, SLP, speech language pathologist, Hayes, Hayes, SLP @uic.edu.
Great, thank you. And Dr. Bondurant at Illinois State University, please.
All right. My first name is Lindsay, Lindsay. Last name is Bondurant. That's B as in boy, O-N as in Nancy, D as in dog, U-R-A-N-T as in Tom. My phone number is area code 309-438-5704, and my email address is lbondur@ilstu.edu. Once again, my email, that's usually the best way to contact me, but email or phone is fine. My email is B as in boy, O, N as in Nancy, D as in dog, U, R, @ILS as in Sam, T as in Tom, U.edu.
Super. Thank you, thank you. Any other questions?
This is Krista. I just represent a lot of southern Illinois, I mean very southern. I'm just curious, with any of those studies, are those anything that you could Skype or FaceTime with? I know Project Aspire things that could be mailed, but I was just curious about any of the other studies, if there are things that are applicable for southern Illinois.
Hi, this is Miriam Redley from the University of Illinois. And we actually have a very nice telemedicine center at the University of Illinois at Taylor Street, right across the street from the Illinois Eye and Ear Infirmary. And we've been working with Rockford, Illinois. We also have been, the St. Louis University has worked out speech-language interventions, early interventions through telemedicine also. So I think it's entirely possible to do this through telemedicine. And I'd be more than happy if you want to email Jean Hayes to get in touch with beginning to work with that.
Okay, great. Thank you.
Okay, thank you.
This is Lindsay from Illinois State University. We are geographically the closest of these four universities, the closest in proximity to Southern Illinois, and as I mentioned, we are willing to do some traveling to collect some of this data. Everything that we're doing is fairly portable, so we can come to you. And my research lab, I didn't mention this because it wasn't as applicable to some of the things we were discussing earlier, but my research lab is very interested in teleaudiology, so using technology in ways to connect patients and healthcare providers. And so I am very interested in trying to use some of those technologies to provide audiology services. So that might be an opportunity for people in Southern Illinois to enroll in some research studies that would not require a great deal of travel. So that's another one that you might contact me if you're interested in exploring some of those possibilities.
And what was your name again?
Lindsay Bondurant.
Okay,
and
great.
I'm at Illinois State.
All right, great.
Great questions. Anyone else?
Hi, this is Cecilia. I had a question for Dr. Bondurant. I was curious about the second one that you were talking about with the early intervention and how it relates to school preparedness. I know you said it was for ages 2.5, I think, and up. I was curious as to how I have a 1-year-old who's hearing impaired, but I have a 2.5-year-old who hears normally but has been getting early intervention services for speech therapy. So I don't know if you only wanted hearing impaired for that or if that was for both normal and only with hearing, or, well, yeah, I think you understand what I'm asking. Sorry.
Yep. Nope, that's okay. Yep, I totally get where you're coming from. And for this particular study, we're primarily looking at kids with hearing loss. Although we would certainly, have some additional interest in maybe collecting data from siblings and children who don't have hearing loss. But as I mentioned, we had submitted a rather large grant to collect some of this data, and the grant ended up not being funded just because it was such a large project. And so we, at this point, are looking at maybe enrolling some kids. So if you have a child who's 1, then when we get the funding to do the larger project, your 1-year-old might be the perfect age for us to start looking at this particular thing. So I would say even if you have a child who's under 2.5, because we're in this early phase, absolutely send me an email, give me a call, and I would be happy to see what we can do to maybe do, at least get your information on file and let you know when we get this study. We think when we do it, it's going to be an ongoing study because it's such a new, not so much a new area, but just an untapped area that nobody's really looking at right now. So absolutely, if you have a 1-year-old and you think you might be interested in talking about early intervention and school preparedness, then absolutely.
Yeah, I mean, it's definitely an interesting topic for me considering both my children are enrolled in or using early intervention services right now. So I'll absolutely give you an email. Thank you.
Yeah, no problem. Yeah, it's one of those areas that we know the research tells us early intervention is definitely a good idea and we should be doing it, but we don't have a lot of information that tells us how much is enough and what kind is the best kind and how long should you do it to really get the best benefits. And that's the kind of thing that Dr. Stiles and I are interested in exploring a little bit. So I will look forward to hearing from you.
Thank you.
Mm-hmm.
This is Carrie. That brought up a great point, too. I think that many of the folks that were on the call tonight and sharing about their studies would be happy, again, even if you might not qualify for the study that they're doing or if maybe that study doesn't interest you. Like they mentioned, they have a database where they keep information about children on file in case a study pops up. And, again, hearing loss is a smaller world. So, finding candidates that fit, whether it's the age, the amplification, communication, and so forth, it even fine-tunes it more. So if you'd like to I'm sure, contact any of them, all of them, and give them your information. And, again, if you don't qualify, I'm sure they'd be happy to keep you on record for future. And then the other thing, too, is some of them also look for hearing children, to do that baseline of, okay, where their hearing peers are at versus the child with hearing loss. So that's something also to keep in the back of your mind where if you have a child that has a hearing loss and one that doesn't, that might be something to mention to the one that you're contacting about their study. We have a few more minutes here. Do we have any other questions? All right. Any other remarks from either the professionals or any of the families?
This is Dr. Redleaf again. I just wanted to thank you again for having us, and thank you for arranging all this.
Not a problem. There is, like I said, our state's large and we're spread out, and there's stuff happening all over. And so any way that we can, help prepare children in the future too through your studies. They're very important. They make an impact on how our practices are done and, you know, what doors may open. So, you know, I definitely see the benefit in this and wanted to be able to share it in somewhat of an easy fashion. All right. Well, thank you all for being on the call. We had, again, a great recording here, and it will be available tomorrow. If you would like that, please just feel free to contact me. Again, any of the information that we had shared tonight will be available through your parent guide if you have a parent guide. If not, you can contact me and I will get that information to you as far as anything the presenters had shared, as well as the save the date and other important updates from Illinois at the beginning of the call. Thank you all for being on the call tonight, and until next month, have a great one.
Thank you very much.
Bye-bye.